Hello everybody, today's video is about methylene blue and also about biofilms. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first question is about methylene blue. It says, I've been taking methylene blue for at about 6 to 8 milligrams per day. I notice I get a headache right after a dose, but it only lasts for 15 minutes. After about 10 days, I develop a rash, some tiny red, almost bite-like, and some that prove to be psoriasis, which I've never had before, and I'm 55. I can't think of anything else I've changed that would cause this. Is this my body getting used to the methylene blue or detoxing, or am I allergic and should quit completely? And I also use red light / near infrared light therapy 6 minutes per day. So thank you for the question. As per usual, I can't give any direct advice over social media, but I have a couple of thoughts that might be relevant or of interest, I should say. When it comes to methylene blue, 6 to 8 milligrams, 6 to 8 milligrams is quite low dose methylene blue. It's in the antioxidant range. It's not in the pro-oxidative, like antimicrobial range. In my practice, when I have patients that have skin reactions when they start taking a supplement like an antioxidant supplement, it oftentimes indicates that there's some type of a detoxification happening, but in my practice, I would typically try them on maybe something else and see how that goes. So, it's like, oh, I'm taking methylene blue. Every time I take it, I'm getting this, skin thing that's coming up. For my patients, I'd probably say, well, maybe let's pause that for a minute. Maybe let's try some molecular hydrogen. Maybe let's try some glutathione. Let's maybe try some vitamin E, and let's see how that goes. Quite frankly, in a lot of cases, my patients probably already would have been trying some other antioxidants first. Methylene blue is great, but it's pretty strong. It's a lot more deep acting, I think, than some other antioxidants that are out there. So I'll usually kind of build patients up to methylene blue. But if they were tolerating other antioxidants and they weren't tolerating the methylene blue, then I would wonder, like, maybe they're actually reacting to the methylene blue. Now, if folks are using infrared light or red light therapy along with methylene blue, well, then that's where you start getting into a question of, like, is this a photodynamic therapy effect that's happening? Is the red light or near infrared light, is it creating this pro-oxidative effect as the light is interacting with the methylene blue and it's in the more superficial blood vessels, and is that maybe causing some skin reactivity? That's just something else to consider. So, for me, if I had a patient who was tolerating methylene blue well, and then they started using some infrared light and that caused skin reactivity, I'd probably say, aha, there's the differential there. But if they were, getting a skin reaction, and whether they used the infrared light or the red light or not, then it's like, well, maybe it's related to the methylene blue. Generally speaking, if folks get headaches taking a supplement, headache within a headache like right away, and then 15 minutes later it resolves, like that's, methylene blue acts pretty fast, but not that fast. So, I don't know this person's case, again, not commenting on their case specifically, but if a patient told me that they were taking really any supplement, like unless it was something that was known to be really, really fast acting, like I get a headache right away, it's gone within 15 minutes. I don't throw around the term placebo effect, lightly, but I would just wonder, like, is this maybe I guess in this case, a nocebo effect? Is it a real thing, or is this maybe a bit of coincidence? Now, if it keeps happening, it's like, not saying it's not a real thing, but it's a little bit just a little bit strange that the absorption of methylene blue takes a little bit of time to get into a person's system, not instantly. So just maybe some food for thought there. But generally speaking, methylene blue, lovely stuff, wonderful stuff, but it can definitely provoke detox reactions in some people. I don't think I've ever seen someone have an allergy to methylene blue. But people can be allergic to just about anything, so it's certainly possible. Anyways, thank you for the question. I hope that information was of interest. I'm just gonna switch screens here. All right, so there are a couple of questions on a biofilm video, apparently a fairly popular biofilm video. 2,200 views so far from 6 months ago for my channel. That's pretty good. It's a fairly modest channel, but it seems like a popular one. 26 comments so far. So let's see here. The question here is, how do you get phase 2 biofilm disruptors in a nasal form or suppository? Didn't even know that exists. Like, how do we get bismuth nasally or via suppository? So thank you for the question. I don't remember exactly what I talked about in this video. It's called Biofilms, Best Disruptors, and How Long They Take to Work. And so I evidently talked about other forms of biofilm disruptors, and there are non-oral routes of administration. So when it comes to nasal phase 2 biofilm disruptors, in my practice, I really only ever use EDTA spray or silver hydrosol spray, both of which are phase 2 biofilm disruptors. EDTA nasal spray, I think it's only available through compounding pharmacies. I might be wrong, but I believe that's the only way to get that. And then with silver hydrosol spray, that's widely available. The product that I use, that I recommend in my practice, is called ACS 200 by the company Results RNA. I have no financial affiliation with them. That's just what we use here, because I like them because they have a 200 parts per million concentration. A lot of the other products out there, Argentine 23 parts per million. I think Sovereign Silver is like 10 or 30 parts per million. I have nothing against those companies at all, just I find the higher concentration seems to be what packs the most punch. As far as a suppository goes, that one's a little bit tricky. So those are also going to be made by a compounding pharmacy as a rule, in my experience. Some patients I've found do really well with suppositories, so like an EDTA suppository, and then some it causes a lot of local tissue irritation. And when you're using a suppository, you don't want tissue irritation. It's a very sensitive area that they're being inserted into. So I've had a couple of patients that unfortunately have had some like really notable local tissue reactions. So I'm very hesitant to recommend biofilm disrupting suppositories, but in some cases we need to go there, and I just let patients know like this could be irritating, so we just give it a try and see how it goes, and hopefully it's going to be well tolerated. But it's relatively rare that we need to use those, I find. Really the only time that, like, I would virtually never use a rectal suppository for a biofilm disruptor. Like, why bother? You just take it orally and it makes its way down the tubing. It would really just be for vaginal suppositories. And for chronic vaginal infection issues, I find that ozonated oil suppositories just tend to work so well that it's very rare actually that I ever need to ask the patient to use a biofilm disrupting vaginal suppository. I've posted other videos about ozonated oil suppositories. If you're watching this on YouTube, please just search my YouTube channel or my name and ozone suppository, and that video should come up if you're interested in that. Or if you're watching this on some other social media platform, then go to the YouTube channel and search, because you can't really search stuff easily on other platforms. Or, well, maybe Facebook's okay. Anyways, search for it somewhere if you're interested. So thank you for that question. And there was one other one on this video. Where are we here? All right. Oh yeah. So this one was, I'm curious to know what to expect to feel or experience while using biofilm disruptors phase 2. I'm about to start and no one is being very clear on how bad I can expect to feel. Well, when it comes to phase 2 biofilm disruptors, if they're not dosed appropriately at the right time in a patient's treatment regimen, a person can feel really, really bad. But the goal is to not feel bad at all. The way I recommend using phase 2 biofilm disruptors is we first start with antimicrobials, whether it's systemic antimicrobials, gut antimicrobials, vaginal antimicrobials, whatever it is that we're working to treat, whatever area you're working on treating. Kill off as many microbes as we can, build up the dose of that slowly, make sure the patient's tolerating it well, keep treating until the patient hits a plateau point, and then we gradually phase in the biofilm disruptor and really are not looking for any flare-up symptoms. If flare-up symptoms occur, then it, in my experience, in my opinion, means, okay, we're treating too aggressively, we need to back off and then go from there. So it's really not supposed to cause flare-up symptoms, at least in my experience. Some clinicians take a different approach than I do, but flaring up typically means, in my opinion, it means that the dosages too high. So thank you for those questions. If anybody has any other questions on methylene blue, biofilms, or any other topic, I'm happy to answer those questions as best I can, and I hope that this was of interest.